Hi everyone, so welcome to one more fantastic 5 MCQs. This is your Dr. BHARATH KUMAR Reddy, Pharmacology faculty. So let us start with the first MCQ. The MCQ reads like this. Patient is on antiarrhythmic drug. He developed hypothyroidism and pulmonary fibrosis. Which antiarrhythmic may cause it? Take a guess. The answer is C. Amiodarone. So amiodarone can cause hypothyroidism and lung fibrosis. Now, procainamide belongs to class 1A antiarrhythmic and the drug undergoes acetylation. You know a mnemonic called SHIP. The SHIP drugs undergo acetylation. So again, procainamide has one specific adverse effect, that is drug-induced lupus. So it can produce drug-induced lupus. The beryllium, amiodarone, sotalol, all these three, beryllium, amiodarone, sotalol, all these three belong to class 3 antiarrhythmic. Class 3 antiarrhythmic. So in that, let us understand the adverse effect of amiodarone. Coming to the adverse effect of amiodarone, I told you amiodarone belongs to class 3 antiarrhythmics, and you know class 3 antiarrhythmics are potassium channel blockers. So what happens in ECG? They can lead to QT prolongation. So since it causes QT prolongation, amiodarone should not be used in arrhythmias called as long QT syndromes. So it is contraindicated in which arrhythmia? In long QT syndrome arrhythmias, because it itself will increase QT interval. Coming to adverse effect, the mnemonic is please check LFT, PFT, TFT and rash. So remember, P stands for it causes peripheral neuropathy. And one more P stands for it can cause photosensitivity. And in fair individuals, it looks like bluish. So we call it as blue man syndrome or Smurf skin. So this is tested frequently. Which drug causes blue man syndrome? It is our amiodarone. So can you tell me which drug can cause red man syndrome? So tell me in the comment section which drug will cause gray baby syndrome, and tell me which drug will cause orange red discoloration of secretions. So try to answer this in the comment section. C stands for it causes corneal deposits. Corneal deposits are also called as cornea verticillata or vertex keratopathy. It can cause liver toxicity. So you will check for LFT. It can cause pulmonary fibrosis. Pulmonary fibrosis, so that is called lung fibrosis. It can cause thyroid dysfunction. Thyroid dysfunction. Is it hypo or hyper? Both. It can cause both hypo and hyperthyroidism. Rash. Why a rash? Because amiodarone contains iodine. Some people are allergic to iodine, so allergy can be seen. So very, very important drug, amiodarone. Already they are tested. Blue man syndrome, hypothyroidism, lung fibrosis have already been tested. So coming back, patient is on antiarrhythmic drug, developing hypothyroidism, lung fibrosis. It is amiodarone. Moving on to the next MCQ. What is the drug of choice for gonorrhea? Ceftriaxone, azithromycin, ampicillin, clarithromycin. So the most appropriate answer will be ceftriaxone. So gonorrhea is a sexual transmitted infection and STDs are a favorite for examiners. Let us see the drug of choice. I have given the STDs here. Gonorrhea or chancroid, it is ceftriaxone. If there are co-infection of gonococci and non-gonococcal urethritis, the best is azithromycin. Why azithromycin? Because ceftriaxone cannot work on non-gonococcal urethritis causing bacteria. It cannot work. Syphilis for all stages, the drug of choice is benzathine penicillin, but it is not given in neurosyphilis. The neurosyphilis, the drug of choice is aqueous penicillin G. Chlamydia, lymphogranule venerum, granulum inguinal, it is doxycycline. If it is not there, azithromycin. Trichomoniasis, where you say strawberry cervix or vagina, it is metronidazole. Herpes, it is acyclovir. So I think most of you know this drug of choices. Coming to the next question. A patient was on clonidine for hypertension. Yes, we all know clonidine is an alpha-2 agonist that is used for hypertension. He stopped taking clonidine and developed severe headache and palpitation. What is the reason for this? Try to answer it. Option A, receptor hypersensitivity. Option B, rebound hypotension, receptor downregulation. So the answer is rebound hypertension. That is why clonidine is not the first line drug. It is reserved for resistant hypertension cases only. And patient cannot stop it suddenly. Why? Because what is the mechanism of clonidine? This is presynaptic terminal, postsynaptic terminal. This is the alpha-2 receptor. So clonidine is an alpha-2 agonist. So when you are giving this clonidine every day, what happens is it will decrease noradrenaline release. So what happens if noradrenaline is not coming down? The alpha beta cannot activate. They cannot get activated. So they keep on increasing in number. So receptor will undergo upregulation. If you don't stimulate them, the receptor will undergo upregulation. So one day, if patient is not taking clonidine 1 or 2 days, then noradrenaline will get released and the number of receptors are more. So this will lead to sudden increase in BP, and that is why the patient is experiencing severe headache and palpitations. So this phenomenon is called rebound hypertension. And this is due to upregulation of receptor, not downregulation. It is due to receptor hypersensitivity. It can be the answer, but the problem is mainly it is the rebound hypertension. It is due to the upregulation receptor. The drug gets released, noradrenaline, and then sudden rise in BP. That is called rebound hypertension. Similarly, there are certain drugs which you should not stop suddenly. If you stop steroid, suppose somebody is taking steroid for 3 weeks, suddenly stop it. What can happen is the BP may fall. The patient may have hypoglycemia. The sodium may fall and potassium may go up. So don't suddenly stop steroid, you have to taper the dose. So if you suddenly stop clonidine, it will lead to rebound hypertension. Beta blockers, don't stop them suddenly. If you stop it, there is increase in heart rate. Patients may develop the risk of arrhythmia, increase in heart rate, and all these things. Don't stop suddenly. Benzodiazepines are studied hypnotic. They are used for insomnia. If you stop them suddenly, patient may have insomnia episodes again. Patient may become anxious again. So these drugs should never be stopped suddenly. Only if you're using for long periods, then don't stop them suddenly. 1 or 2 days, no problem. So repeat again, steroids, clonidine, beta blockers, benzodiazepines are very, very important. The sudden stoppage is a problem to the patient. Moving on to the next MCQ. Which anti-diabetic drug is recently approved for treatment of heart failure with low ejection fraction along with low urine output? Now, empagliflozin, degludec, linagliptin, rosiglitazone. Rosiglitazone and pioglitazone, they are similar mechanism. They are PPR gamma agonist. They are called as thiazolidinones. These are not at all given in heart failure because they cause sodium and water retention, so they are contraindicated in CHF. Linagliptin is a DPP-4 inhibitor. It is one of the safest to give in renal failure, but it will not help in any renal failure, but you need not do dose reduction for that. Degludec, remember, this is the longest acting insulin which works for 42 hours. Remember, it works from December to December. Just to remember, December means long acting. Anything ending with gliflozin, it is a SGLT2 inhibitors. Nowadays, SGLT2 inhibitors are very, very discussed drugs in almost all the conference because they are approved for diabetes type 2, They are having benefit to decrease mortality in CHF. They are good in patients having risk of cardiovascular disease. They decrease that risk factors, and they're also helpful in CKD patients. So 4 indications now SGLT2 inhibitors are given. So that is why the best drug and the best option of what I can choose is empagliflozin, because patient has heart failure and reduced urine output, so it can be beneficial in both. So the answer is empagliflozin or any gliflozin, and that is SGLT2 inhibitors. Coming to the last question, all the following drugs are used in thyroid storm except propranolol, lugolzidine, propyltyrosol, and D-aspirin. First of all, what is the meaning of thyroid storm? So thyroid storm is nothing but when you're doing the thyroid surgery for hyperthyroidism or Graves' disease. When you cut the thyroid, the thyroxine T4, T3 may be released in the circulation. So this increases the heart rate. Just a minute. Okay, let us resume again. So what happens in thyroid storm? There is a release of T4, T3 into circulation. This will increase the heart rate, and that can lead to arrhythmia episodes. And second, it can increase the body temperature. That is hyperthermia. Now, we use drugs like propranolol. Yes, it is used because propranolol can take care of arrhythmias, decrease the heart rate. It can be beneficial. Lugolzidine is the fastest acting drugs because they decrease the T3, T4 release. They decrease T3, T4 release. And what does beta blocker propranolol do? Propranolol also decrease the incidence of arrhythmias. And also one more advantage is it inhibits the conversion of T4 to T3. Then we have propyltyrosol, which is also used. That also will be beneficial because it inhibits T4 to T3 conversion. Now you know that the most active is T3. That's why we don't want T3, which will cause more problem for the patient. So propranolol, lugolzidine, propyltyrosol all are used. Then what is not used is aspirin. Why aspirin is not used? Aspirin is an NSAID, and as you remember, it should have decreased the temperature, right? It's a antipyretic. If there is increase in temperature, then why not we give aspirin? Because aspirin displaces T3, T4 from the attachment, and they increase the T3, T4 level. So it will worsen the thyroid storm by displacing T3, T4, making them free. That's why aspirin is contraindicated to manage hyperthermia here. Then what should I give for a hyperthermia patient? The best drug we can give is paracetamol. This can take care of increase in temperature and it doesn't interfere with displacements. So I told you 3 drugs for thyroid storm: propranolol, lugolzidine, propyltyrosol, and one more. Remember, we use steroid like hydrocortisone. Why hydrocortisone? They can overcome the stress which is seen during thyroid storm. Okay, so these are the 4 drugs. Now tell me, same thyroid storm happened. Thyroid storm happened in this patient, but patient is asthmatic and patient developed atrial fibrillation. In this case, to control atrial fibrillation, to control the heart rate, will you give propranolol or will you give CCB diltiazem? You have to tell me in the comment section. So that is about the thyroid storm, how do we manage, and what are the important points. So with that, we're done with this fantastic 5 MCQs. If you find this content useful, like the video, subscribe to the channel and share to your friends. And any queries, this is the Telegram group and Instagram where you can follow me for more updates. Thank you all. Take care.